Good afternoon, everyone. This is our fourth week of doing these webinars. Let me just change the view a bit. And these webinars are brought to you by SpaceNet Global Group with the support of EZMed and Medici. And it is such a privilege, and we are very humbled for all the attendees that can join us today. I see the numbers sort of ticking over. We're nearly to sort of 320, if I'm correct. The webinar is also accredited for 1CEU, so if you logged in with your own credentials, you can expect a certificate via email to reach you shortly after the webinar. For everyone who joined us at the moment, just to let you know, this webinar is recorded. If you want to view it again, you can always log on to the website, ezmed.solutions. Go under the webinar tab, and you'll be able to find the link to this webinar, as well as to all our other previous webinars. And we've covered a range of topics. We started with navigating telehealth. We spoke about future-proof your practice, telehealth post-COVID-19. We spoke about the do's, the don'ts, the desk and dress for practicing telehealth. And tonight, as you know, we're addressing how to build patient trust in telehealth. We had two fantastic demonstrations. The one was the EZMed Medici integration, a complete telehealth solution. And just last night, we also had a practical demonstration to IPASA, the Educational Psychologist Association of South Africa. So all of those are available to you under the webinar tab. Just log on to the website, ezmed.solutions, as you can see on the top left of your screen. Please feel free to post any of your questions to our panelists today. If we can't answer them during the session, we are going to compile them in a document, and that will be made available to you on the webinar tab as well. If there's any other documents, and I knew, Neil, you're very good with this, you always write an article for us, that article will be posted in exactly the same place under the webinar tab. So everything is available for you to use. Now, guys, I'm going to try my best tonight to do a poll. One or two questions to the attendees. Please watch out, and I really hope time allows, and we would really appreciate your participation. But maybe let's kick off, and I just want to try and welcome a few people who I've seen as attending today. We've got Charmaine Corporal, who's a senior lecturer at the Durban University of Technology. I saw Bradley Beckerleg here. He's from SAHOPA, and he's the vice chairperson there. Welcome, Bradley. We've also got Mariette Deist, another orthotist prosthetist, and she's actually at the Health Profession Council Board. We've got Nelfrey Kemp, a podiatrist and the national chairperson of the Podiatry Association. And I also see another familiar name here, Alison Dent from SASHA, and she's on the Ethics and Standards Committee. Guys, there's so many people that join us so far. I know there was a lot of people that, that registered, and I know there's over 160 psychologists that registered. There was 88 bios. We've got nearly 100 OTs and close to 80 physiotherapists. So really, a great, great welcome to you all. My name is Lani Ace. I'm a product manager with the SpaceNet Global Group. And today we've got one new panelist with us, Steve Murray. Pardon me. Now, Steve, pardon me, Steve runs a specialized healthcare consultancy called Health Architects SA, and they build technology-enabled solutions with a focus on chronic disease reduction and prevention. They do this for employers, clinicians, health and fitness operators. And Steve partnered with Jenny Haig Physiotherapy to implement these solutions in a very clinical setting. So hopefully Steve can share some of his insights and his opinion with regards to using a practice management system that's integrated and how to utilize a telehealth platform in his practice and with their patients. Welcome, Steve. Thank you so much for joining us. Also, someone that doesn't need any introduction is Dion Beer. Pardon me. Dion is the director of Profnet Medical, and he's also the original brains behind the practice and patient management system called EZMed. Dion is also the SpaceNet Global Group executive for operations, and like myself, Dion is a physiotherapist by training. For those of you that don't know the other young, handsome fellow with us, Neil Kinsley, the CEO of Medici Africa, which is a secure telehealth platform that originated in Austin, Texas, actually. But it was developed by one of our own fellow South Africans, Clint Phillips. And there's also a brilliant video of Clint on our website. Welcome to you all. Now, if these virtual walls around us could talk, I think it would be whispering that we are 76 days into the lockdown. And yes, there are still certain uncertainties, but it is also as if we are ever so slightly getting a little bit more used to this new normal. I was thinking about something that Churchill said just this afternoon: never let a good crisis go to waste. And in true South African form, we come up with alternative solutions to problem solve and to get us through a crisis like COVID. One such a problem in the healthcare environment is to still have the ability to provide consultations to our patients, but without crossing the social distancing barriers, and also not exposing those especially vulnerable patients to unnecessary risk and asking them to come into your practice. And this is where telehealth comes in. But how do you convince your patient that it is safe and secure and very convenient to use this telehealth platform? How do you gain their trust? Neil, I think you mentioned in a previous webinar that Medici in the United States actually saw 1,000% increase in utilization for both healthcare providers and patients. Now, do you really want to tell me that the patients in the United States are that different to ours? I'm still not convinced. I think the patients and sometimes even the healthcare providers are a bit skeptical when it comes to using a telehealth platform. But maybe before you answer me, and I'm going to hold you to that, I want to try and ask a question. I'm going to get the attendees to please answer. It's a very quick and easy question. Are you currently using a telehealth solution? And you should see that pop up on your screen as I speak.
Good.
I'm going to end it very soon, but maybe Neil, back to you. Is there such a difference? Are the South African patients different to the ones in the States? And how can we get them to engage on a telehealth platform?
Well, afternoon, everybody. Thanks for having me again. It's great to be on once again and to see so many familiar names. So no, of course not. I mean, our patients are exactly the same, aren't they? And what's actually even more fascinating, let's bring it back to home, is that I've seen how some practices here locally back home in South Africa flourish in terms of telehealth. And then you have another one that actually just is a non-starter. And you've then got to ask the question, are the patient demographics vastly different? Are the solutions that have been implemented, is the one a lot more difficult than the other one? So I'm hoping to answer some of those questions this afternoon, give you some insight into how to instill, and get your patients on board. I've once again, as I did last week, I've spoken to a whole bunch of providers here and in the US, accumulated about 30 or 40 different tips, and I've whittled them down to 7 that I think are probably the best ones, and the ones that I'm going to share with you this afternoon.
Fantastic, fantastic. Dion, do you have any thoughts around that?
Lonnie, firstly, hello, Neil. Hello, Steve. Thanks, Lonnie, for the nice introduction. I think we often come with preconceived ideas about what we think can and can't work. I think if I just reflect at being a father of 4 kids, I reflect back to pre-COVID days and think, homeschooling, it was always looked at in a different kind of light. I think we can, all those with kids will attest to that. And you think homeschooling, well, that's for some kids, not quite for my kids. And then suddenly your hand is forced in that, and you realize that the technology has been there for a very long time to enable this effectively. It's not new technology necessarily, but it's been there waiting for this catalyst for change. And then you start doing homeschooling, and you've got Zoom sessions or Skype sessions or Teams sessions coming in, and your kids are engaging with us, engaging actively, very productively, and very effectively. And suddenly those barriers of, I'm not ready for the technology, my kids are not ready for the technology, technology is not ready for me. Suddenly all of those fall away. And we're finding exactly the same thing happening in healthcare. And I'd like to encourage all those on this webinar today to just keep an open mind. When I first started engaging on telehealth, my first question was, well, can my parents manage it? My dad's 71. He has a disability. He's deaf. And I was going, well, there's no way he's going to be able to adopt this. He can't even download a WhatsApp app and manage that. And I get a phone call to come in and sort it out for him. But I thought, let me give it a try. And I was absolutely blown away. As I've been blown away about how my kids have managed homeschooling, And I'm reconsidering whether we go back to conventional schooling. I was blown away by how my parents have adopted it in a simple way, an easy way. And I'll reconsider whether I'll go back to conventional ways of managing and engaging with my patients. So I think, as you rightly said, Winston Churchill had a great quote there. And we shouldn't let the crisis go. It's allowed us to explore new spaces, new ways of doing life, and we should look at new ways of doing practice.
Yeah, for sure. Now, Steve, obviously you've got a hand in quite a few practices and centers. What's your opinion? What's your take on telehealth?
Well, I mean, I think a couple of things. First of all, Dion and I have had this discussion over the last, some years, and I agree with him completely. I think what's happened with this pandemic is simply, and it's a couple of books that have changed my life. Two, in fact. One was the Complete Heart Recovery Guide by Dr. Neil Gordon. The other one was the Innovator's Prescription. And I really encourage anybody that's in healthcare that's looking to understand or to get a model around what's happening now to read that book, written by a guy called Clayton Christensen. And he spec'd a model, and I'm watching it happen in front of my eyes. And fundamentally, the healthcare has been very, very slow and to disrupt. If there was an industry that needed to be disrupted, it's healthcare. But it has been incredibly stubborn to disrupt. And his reason for it is really lies around the statutory and legislative strength and the way in which those things are set up. But this is simply the scenario for me is the stable door's open, the horse is bolted, it's gone. So and the attempt to hold that back, I think, is over. Yeah. So I think that we've seen probably 5 to 6 years worth of disruption in 3 months. So that's my take on it, is that we find ourselves in a situation that would have happened anyway, but it would have happened in 5 or 6 years' time. And now we have to deal with the reality of it being right here, right now. So that's kind of how I view it right now.
It seems as if a lot of the healthcare providers are actually that's attending today, they're thinking the same thing. I'm trying to share the results. I hope it is actually on the screen, where you can see 44% are using a telehealth platform. And I think that percentage is growing as we speak. So very interesting results. Thank you. Thanks for voting there.
Lonnie, can I maybe ask a question on that?
Of course.
I'd love to say, you say 44%, I think you said, hey?
Yes, 44%, yes.
Yeah, the other 56%, I'm gonna now steal something that Neil said before, and somebody I see is even mentioned it in the comments here, saying, after Neil mentioned that all communications, in other words, SMS, WhatsApp, etc., is telehealth.
It's telehealth.
I realize so many people text me all the time and get my best professional response for free. So thanks, Neil, for the awareness, and that's from Sahana. So thanks for raising that. I think that's from previous webinars. So the other 56%, I think if we made the assumption that you're not using any of those platforms, I think we'd be challenged on that number, and it might go very close to the 100% mark.
Absolutely, absolutely. Because you think WhatsApp, SMS, Skype, it's all telehealth. It's all a digital platform. Definitely, definitely. Neil?
I must say, I'm quite fascinated by what Steve said now, because there was an article at the beginning of December last year, was put out by Fortune magazine, and they predicted that within 6 years from now, virtual consultations would outnumber in-office consultations.
Sure.
The truth is that what has happened in the last 3 months has pulled that 6-year prediction closer to a year to 24 months.
Yeah,
definitely.
Yep, I agree with that.
So Neil, have you been, sorry, not Neil, Steve, I've got another question for you. In your and in Jenny's practice, has it been difficult for you to get the patients to engage and to trust a digital platform?
Lonnie, that's an important question. To think, it carefully, because the answer is yes and no. So let me say this. I think the journey that we started down this road started a year ago. It didn't start now. It started with us migrating to EZMed in December, because fundamentally we needed to understand, how do we pivot this business to be able to be ready, not providing, but ready to deliver a fee-for-service based environment, but alternative methods like fee-for-value and fee-for-membership, which I believe are critically important. I don't think that the fee-for-service environment is ideally suited for things like prevention, and that's certainly not suited for things like chronic disease management. And the allied teams, the allied folk in South Africa, the biokineticists, the physios, are just ideally suited to be able to deliver that. But the funding mechanisms are not quite there. So we set out to be ready for that in a couple of years' time. So so coming back to, is it easy to get people to engage? I think the important thing is that if we are looking at this simply as a way to move the point of care from the practice to the home, I think you're going to be disappointed. This, so for me, the growing of trust with patients is all about the continuum of care, because that is fundamentally the difference between where we were and where we were trying to get to. So continuum of care versus episode of care, very important. And I love the way that Dion and the team had built that already, that intelligence into EZMed. So, so we were pretty well set up to do this. So the answer, is it difficult to get people to trust you? Yes, it is. And I tell you what, it might be more difficult to get the people in your team to trust it than the patient. So if they're practice owners and so on in the audience, the hardest work for me over the last 3 months has not been to engage with patients, but to get therapists in our business to trust it. Wow. So I think that's really, really important. So right now we are using the Telehealth platform. In fact, it changes every day because today we started to physically build, but we've used it as a way to really cement the continuum of care, which we are trying to create, so that the therapist has multiple ways in which they can deliver care, but very important that there's a continuum of care, not simply an episode of care where we have a discharge patient. I hate that word. I'm saying to Jenny, we don't discharge patients. Why do we discharge patients for? It's not a hospital. We're an outpatient delivery system. We don't discharge our patients. We simply move them onto a different path. So, but I do want to say this about, we tried SMS, we tried a website, we tried groups, and the one that created the most engagement without anyone doing anything was Medici. So Neil was very kind. I don't think he knew it at the time, because I sent out 5,000 SMSs. Sorry, Neil, I apologize for this yesterday as well, but which he paid for. Thank you. But we sent it to our patient base, and the interesting part was that platform was by far the most engaged with. So we had more than 100 patients download the app, download the information, put in a payment method without anything more from us than simply an SMS to say, hey, this is what we can do. And that was by far, of all the SMS, WhatsApp, website groups, mobile app, that was by far the most productive.
Steve, I think Lonnie, if I can maybe come in there, I think what is really wonderful that you've pointed out, and I can actually share some thinking that I've also had feedback from Megan, one of our podiatrists using EZMed and has now taken on the Medici component, is that it's an addition. It's not an alternative necessarily. I think when we were in level 5, it was the only alternative. We saw practices not being able to see patients, and they're saying, please give us an alternative. My practice is dying. If we move back to level 5, I guess that would be our alternative, that we could then at least engage with the patients, check that they're okay, maybe see a red flag and say, I think you need to be admitted, this is serious. So I think it does allow us another channel to reach out to the patients. But in the levels we are now, it's a complementary service that flanks in with your services, as you raised, doing things like a remote clinics, and preparing yourself beforehand by dialing in and being able to speak to those patients, triaging the patients, saying, listen, I need to see you before 9, you first in the queue. Yours is not so serious, stay back. And you, actually, I don't need to see you this month. I'll see you next month when I come up for the clinic. I think these are ways where one can use these tools to reach out, do one-on-one assessments if possible. And I think there's various disciplines that can do that. Other disciplines can't necessarily do the assessment, but most certainly give the advice, follow up, check if the patient needs to come in. So it's another tool, which is just a magic addition to our practices to complement those and just to spread that net further on how we actually deliver our services.
Dion, the other thing that we spoke about earlier this week was, and I think, Steve, you touched on it, it's this continuation of care with your own healthcare professional. And the patient doesn't get allocated a healthcare professional that is picked from a pool.
Great.
Yeah.
Absolutely. Look, and I mean, yeah, I think, Dion, I just want to, maybe if you don't mind, coming back to, you know, the actual practical implication or the practical applications of this. Because I also have a job now. I'm employed by my wife. So I'm no longer a consultant. So anyone who thinks that is a soft landing, I can assure you that is not. I've become very, very familiar with the Serenity Prayer, have downloaded any 12-step program. But fundamentally, we built this model around the principle of a care coordinator. And the one thing that EZMed does for us is allow us the coding, the day-to-day administration to go back to where it should be in the hands of the therapist, because they should be the only ones who are doing that, and it's quick and simple to do. So it's allowed us to completely and fundamentally reorder the practice administration and create a care coordinator. And I think that is the role I play all day at the moment. And the ability to reach out to patients, Dion, your point, what I do now, a new patient phoning in, I use Medici to connect with them and do brief pain inventory, or to do any range of measurement instruments that we've created on our platform to be able to understand what that patient's real needs are. Yeah. It also commercially makes sense because you're doing an assessment, which means that you can do a reassessment. And you know, you know, you can't reassess and you've assessed. So it does make commercial sense too. And it allows us to create the, you know, the motivation document that the schemes require. So I think what we mustn't think only of this platform application as being when a patient has already joined our practice. What about the patient who's phoning in to find out about your practice? It allows you a very, very cool and elegant way to connect with them and ask important information that you might not have been able to before.
There's two things that come up from that, and it does flank into previous webinars, is that people are asking the question, but hang on a second, this is a new patient to the practice. What does the ethical regulation say around that, whether it's HPCSA, Allied HPCSA, Nursing Council, and so on, Social Work Council. So I think just to update everyone on that, who haven't been following what the HPCSA has been saying up until now, and I'll use HPCSA because I think sort of 95% of our delegates, but the same applies in the other spaces, is that they did lift, firstly, telemedicine was allowed before, but it was a consultation between a practitioner, who's the consulting practitioner, and a servicing practitioner, with a patient on the other side of the servicing practitioner. But the first step from the HPCSA, following the Allied HPCSA, in fact, that took the first move, was to say that you can do telehealth directly to the patient, but it must be an established patient of the practice, while the Allied HPCSA said, no, it can be new patients. That was then followed by the HPCSA quickly pulling up their socks and saying, in fact, we understand the COVID crisis. We have to open this up to new patients to the practice too. So if there's any questions from our delegates around, but hang on a second, you've got a new patient to the practice and you're engaging by telehealth, the ethical regulation does allow for that. There's obviously frameworks that you have to consider, like informed consent, as you normally do, financial consent, clinical consent. But then thirdly, you'll be adding in your informed consent from a telehealth point of view. So it's very important that your patient does consent to the telehealth engagement, because there's certain terms and conditions that apply to that, not just on the practitioner, but the patient finding a secure, safe environment, undistracted environment to engage professionally. We've had a whole webinar on that as well. So you're welcome to have a look at that too.
Yep.
Yeah, you know, Steve, just on that point, and it's a point that I want to bring up again, is, you know, you're talking about the 5,000 patients that we sent an SMS to. I mean, we've looked over the years very hard at, you know, how do we get patients to trust telehealth? How do we get them into the practice? And I mean, you're actually then, you know, what you've mentioned sort of touches on my first 2 points. And that is that the most successful telemedicine ventures start with the practitioner or the provider introducing telemedicine to the patient. It has the most credibility when it comes from the trusted provider, no doubt. And I think you probably find that one of the reasons that our SMS campaign with you was so successful for you is that it was obvious to your patients that we were doing it in conjunction with your practice. You know, we weren't just a third party from nowhere sending out some kind of detail to your patients. It was obvious to your patients that this was a joint venture, and that Medici together with yourself, was introducing telemedicine to them. And I think that's probably one of the biggest points to be made, that if you're going to bring telemedicine in, and there's nothing more frustrating, I think, for a provider. They go through all this trouble of trying to understand which solution to use. Then they go through all the different solutions. They eventually find one that they want to use. And the success rate is low. And mostly because the patients very often don't even know that they're providing it. So when we're doing something like this and we are inviting patients to join Medici in conjunction with a provider, there's nothing more powerful than that. And then the second point to that is you've actually got to market to the fact that this is what you're doing. I mean, you're not touting, you're literally just telling your patients that you're available for telemedicine consultations. And, as we did with yours, these are all existing patients of yours. These are not patients that you don't know. You've actually got to let them know, because if you don't, only you'll know and they won't, So you've actually got to, you've got to take the time to send out. And I mean, I've seen probably one of the best things I saw a provider do is they made a little one-pager, made it look like a fridge magnet. And it just pretty much had the benefits of telemedicine, what they provided, when it was appropriate and what their rates were. And their patients, and they sent it out to their patients, and their patients could put it on the fridge, and it just reminded them that when they required care, they could potentially look at telemedicine first. I mean, you've actually got to do that. It takes a little bit of work, and I see a lot of providers, they go through a lot of trouble bringing a solution in, and a month down the line, hasn't really worked. So I've sort of given it up.
I'm not sure, Neil. I absolutely understand that, and I think you're right. Obviously, the point of trust is fundamental, and as a service business, before pre-COVID-19, one of the biggest mistakes we made in the service providing services in this space was forgetting that the clinician is not going to outsource their patients to you. So as a service provider, that's really important to remember. So if you build something inside the practice that's driven by the clinician themselves, you're correct. But I must tell you that we sent that same message to patients using different mechanisms. And I think in South Africa, we're guilty of underestimating our patient base in terms of their understanding. Because fundamentally, there was a difference between Medici's take-up and, let's say, for example, a mobile app that I built. And I can tell you now, it's because people read what it is and what you said. The safety of the platform, the way in which things are protected, the way in which you lay that out, I think is really, really important. And we must not underestimate our patient base and their understanding. I think people often go, oh, well, the US, we're 10 years behind. Nonsense. We're not 10 years behind. Our health coaching partnership in the US sent me a document sent to Congress way after you launched. So in the United States, physical therapists were only looking to try and get telehealth benefits approved by Congress way after Dion and you had concluded this and made it work. So I think it's dangerous to simply say, well, South Africans maybe not a first world environment. I think that's wrong.
I agree. I think we must remember that in South Africa we have more SIM cards than the population. Now, sure, there's some cards that are also in automated gates and so on, but don't underestimate that. I think it's the number something crazy like 1 in 40 people worldwide are using an MTN SIM card. So let's not make that call or put up that barrier up front, but allow the patients to make those choices on how they engage with the practice. And of course, this is not a replacement for face-to-face, and you might even engage with the patient through telehealth and go, hold on a second, I can't do this through telehealth. I'm concerned. I'd like to see you in person, or go to your closest A&E, or go to your closest physio or OT or speech therapist, whatever it might be. But it gives you the ability to do that. But I'd like to also just maybe close the loop on, we're talking about building patient trust in telehealth. I think when one encourages a patient to say, listen, you know how we've always been doing things? Well, all of that's out. I'd like you to step right out over there and use a totally different platform, and we're going to do it that way. There's a concern there where you've got harmonizing within your current practice processes. And I think this is some of the magic of what we put together, Neil, is that you're saying to the patient, I'm still going to bill your medical aid like I always have. I've got your details on my system. I'm going to be sending that through by EDI, or you're going to be a cash practice, or whatever it was, status quo. I understand who you are. You still know me. There's an established relationship. But what we're going to do is just open up another channel of engagement. And that is a convenience to you, a convenience to ourselves, and it's an option that you can then choose into. So you've got a moving part, but it's not the entire thing changing. And we've done that quite successfully in integrating EZMed and Medici into one place. But that also flanks into another question that came up in our Q&A elements, which is, okay, so now I want to move over to something more formalized. And we have to recognize that using WhatsApp or SMS or email sometimes even as well, the patient's actually connecting with you as an individual, not as a practice. They got your personal cell phone number, and that's what they're sending to. Now, there's ethical issues around that. There is the professional barrier or relationship that is being broken here. They might be messaging you after hours and on weekends, and it all becomes a little messy. So the question here is, I've been doing that up until now. I want to tidy up. How do I bring this all back into a formalized environment? And Neil, I think it's great if you could answer that. But before I do that, I would like to encourage everyone listening to try and find a central place where all of this is stored. So if you are SMSing your patients, that it's stored centrally against the patient record and history so that you can look back on that in years to come and not flummox around between all your different platforms. And my goodness, is it on my WhatsApp backups? I hope I've got that because I gave clinical advice here and then I send something up through a tweet to the patient and I need this in evidence in court. So have it all centralized in one place, whether it's SMS, an email, a phone call, a video call, a text through Medici, all of those harmonized in one place, in one record, so that you've got that professionally and collated all in one place. Neil?
Yeah, I mean, that's such a good point, really. In fact, I saw there was a note over here from one of the panelists, or one of the providers that are out here, attendees. That's the word. Thank you. Yeah. It said, do the poll again and ask again. Now, now that we've sort of said, if you're using WhatsApp and email, etc., the poll would be very, very different. And I actually saw some responses coming back saying, yes, exactly what I do. And I think that's such a good point. And, it's something that I get probably every single day, is that I'll get a provider that'll come to me and say, what do I do? Telemedicine doesn't work for me. My patients prefer to WhatsApp me. It's pretty much telemedicine is working for them. It's just that they like using WhatsApp because that's what they're used to.
Yeah.
There are a whole bunch of, and as you've pointed out, Dion, there's a whole bunch of problems there. If they're WhatsApping you, they've got your personal number. They're using a social media platform, if you like, for the exchange of clinical data. Yes.
Tell us a bit about that social media use. Now saying that, Neil, you mentioned something around anything in WhatsApp actually becomes part of media regulation. Can you share some of that thinking?
Well, yeah. I mean, so, we spoke about this, I think, last week or the week before about end-to-end encryption, and it was one of the issues that I brought up when I said, when you start looking for a solution, these are the checklists, and if you go to the website, you'll find my checklist to what you should look out for. And end-to-end encryption was one of them. But there was so much more to that. And my point around WhatsApp is that it's absolutely secure and it has end-to-end encryption. And in fact, there are new versions of WhatsApp that are coming that are going to be even more secure, announced as it yesterday. But there's so much more to it. You have to remember that WhatsApp fundamentally is a social media platform. It was built for me to chat to my wife and telling her that I'm coming home late. That's what it's built for. It wasn't made for the exchange of clinical data. And it doesn't have what the other elements that are in my checklist. And that's what you've got to remember. And I see there are a couple of questions here. Once again, if I use WhatsApp, what is the difference? And the difference is there's a lot more to a solution than just it being easy. And, to be fair, somebody, whenever you started using WhatsApp, you had to download it once and set it up. Once it's set up, it's done. It's pretty much the same as, within Medici, for example. Once it's set up, it is done. But I think that the way that I've seen a lot of providers get around that is they will say to their patient base, I'm very happy to work with you in a virtual environment. And in fact, I encourage it because there are so many benefits to it. And this is one of my points as well, is that take the time to go through those benefits with a patient. You don't have to get into your car, come to my rooms. There's so much time wasted in that. If it's appropriate, absolutely. And we can, deal with it. However, I want to make sure that my data is safe and secure and compliant. I want to make sure that we do this properly. I want to make sure that there's an audit trail. I want to make sure that whatever we're using is safe for both you and me. And all I'm asking is help me to make sure that that happens for both of us.
And
That's
the
a very good
patients need
point.
that reassurance, right?
And it's not that.
They're in safe hands. Their data, the information, the processes, who's on the other side, all of those things. And it's important to give them that secure environment to do that, to make that change. Steve?
And it's not that it's not that difficult to do.
No.
So, for example, what we do, we have a business WhatsApp. Okay, so in other words, there's no therapist names. There's nothing personal. Business WhatsApp is actually a really effective tool. So for those people that want to find an easy way, it's pretty simple to set up. And then you're able to set up a catalog in that business WhatsApp, which you can't do in your personal. And what we've got in our business WhatsApp catalog is the reasons why telehealth should work for you.
Yeah.
And I don't know if I'm sure a lot of you out there will be aware of the class effect. You know, the class effect says Rassi Erasmus and the guy who coaches the under 13 C team at the high school down the road are both coaches. But they're very different. So they both call themselves rugby coaches. But there's a fundamental difference between the two of them. So, and often if we don't highlight the difference between what you're going to pay Rassi Erasmus to coach you at whatever 20 million rand a year, and the guy who coaches the under 13 C team, which is probably some, a couple of a bottle of Jack Daniels and some oranges. There's a difference. Now, the danger is that you get lost in that, and everyone just goes to the and we commoditize, and we end up at the lowest common denominator. So we've been very, very clear about saying there's a reason why we use Medici. I'm sorry, it will take a little bit of time, but the reason is that it's compliant with every single. So if it's HIPAA compliant, it means it's GDPR compliant. It means it's POPI compliant, which means that your data is safe. And so we've put together a little one pager. You speak about the fridge magnet. I stole that absolutely and did that. So that is downloadable from our catalog in WhatsApp. So there's a reason why we will not share clinical data on WhatsApp. And it's written down. So if you want to see it, go to our catalog and find out. But nobody, it's actually quite nice. I must tell you, it's actually quite nice to say to a patient, I'm sorry, I can't do that. It doesn't make sense. So if somebody out there is providing services to you over WhatsApp, I think you need to ask some hard questions about how safe that data is and why you're doing that.
I think that's great. I mean, it's important to be fair, to be open. And I see guys are commenting here saying WhatsApp business is awesome. And it is for the purpose that it's designed for. And inform the patients why. You're not trying to strong arm them into one or other space, but it's important that they're turning to us as the healthcare professionals who've reviewed the ethics, the security, and so on, and decided which they're going to back. And I maybe just want to say here is that both EZMed and Medici, we put together a documentation and a proposal through to third-party insurance underwriters on our malpractice insurance policy to say you're penalizing people where there's a claim against you for telemedicine, for telehealth engagements. You're increasing your excess payments by 50%. We'd like you to waiver that 50%. We take on the risk. We will show you how we've done that and how we're managing the risk from a security point of view, patient data point of view. And we submitted, it was 60, 70 pages of documentation around the security level of what we're doing in combining EZMed and Medici together in one. And they looked at that, they reviewed it as a third party and said, we waiver that additional 50%. So that speaks a lot to a third party reviewing and saying, listen, we're going to put our money where your mouth is really and back this. So all of these things accumulate to giving that patient that sense of comfort of saying, how do I build this trust relationship, extend on my trust relationship with the patient in a safe, secure place, and not just throw it out to the least cost, but the best value platform. And there's a difference. We're not going to have a cost battle. We're going to have a value battle. And I think that's where we're winning it very strongly.
Neil,
Steve, I mean, what I'm hearing, sorry, what I'm going to say, Steve, what I'm hearing from you is one of the fundamental elements of a successful telehealth practice. And that is you have made virtual consultations part of your practice.
Yes. It's not a panacea. It's not a silver bullet. It's fundamentally a way in which we can start to use the digital world to drive additional services. And for me, fundamentally, what I like, or what I'm really trying to focus on, is that for me there are three major revenue streams here, if you want to just talk commercially, is that we need to understand what fee-for-service does. And fee-for-service is highly effective for illness and injury. But the allied folk out here, we've got to be in the world of chronic disease management and prevention, and we've got to be trying to get people before they even get into a position of risk, which means that we have to find outcomes-based ways in which to track data and people over a period of time. So we need to understand we've got demographic data, which comes into our practice management system. That's what I love about where we're positioned at the moment. So EZMed does a fantastic job at collecting that. Clinical data is coming into Medici, and activity data we're getting in via another third-party platform that we use. So I've got a really, really rich view of a patient over a period of time. And for me, that's what I don't want to lose sight of, is that telehealth is not simply a way to move the point of care. It's absolutely a way to drive a continuum and to drive long-term relationships with patients, and to help them, because let's understand, I mean, I think everyone's worked this out by now, is that human beings don't do what they're supposed to. If they did what they were supposed to, all of us would be out of a job.
Yeah.
So I say this to doctors every day, you know, so like, doc, now how does it go? Do you tell people, do you encourage people to be physically active? Yeah, I tell them. And if they don't do it, they're going to die. And I'm like, well, how is that working for you? You know, it just doesn't work. So we have to understand that behavior modification and coaching is a fundamental skill and a fundamental value proposition that the allied peeps in South Africa can offer. Biokineticists do not exist anywhere else in the world. And the fact that those people are not absolutely driving the chronic disease risk reduction, which is now absolutely front and center. You know, everyone with hypertension is going, oh, well, so what? I take a pill. Now they're going, shit. Oh, sorry, excuse me. And now, if I don't get physically active, I'm going to die from this thing. So we're in a different space, and I think so. I think that what Neil and Dion have created here is an opportunity to do what we're supposed to do. And that's be movement experts and to be health coaches and to track and manage our patients over their lifespan. So cradle to grave, you know. So the whole principle of an accountable care network that tracks patients over long periods of time can become a reality. And that, you know, that's something that Dion and I spoke about 4 years ago, when we first met. So I agree with you. It's not a silver bullet, but it's certainly a way that I think we can change the narrative. And that's really, really exciting.
Yeah. I love your the way that you sort of put this out. And I mean, it's I just think that I'm hoping that this is giving a lot of the attendees some insight into what you've done. But I love the you know, that you speak about the fact that you know, patients don't always comply, and there's been such interesting research, mostly in the US, around using telehealth to make a more compliant patient. And because you're able to use telehealth and have more points of contact with your patient, you tend to have a more engaged patient, and a more engaged patient or educated patient very often is also a more compliant patient. So, you know, telehealth is also used, because I think there's a perception very often that telehealth is like this. It's a video, and both patient and provider have to be together at the same time. And we have this kind of exchange, and, you know, there's so much more to it. But one of the things that telehealth is so good with is, you know, what we do, for example, is that you're able to attach documentation or educational material. So if you have a new patient, for example, who might be diabetic, you're able to attach educational material around lifestyle, exercise, food, etc., educating that patient. And it's been, you know, it's been proved so often around the world that if we can just use telehealth to educate the patient, they become more compliant. And that really talks to the point that you've just made.
Definitely. I'm watching the time here. We've got about 10-15 minutes left. And Neil, you did give us one or two of your tips, your points. And I'm scared we're going to run out of time. Do you mind just maybe sharing one or two more?
Sure. So, I mean, the first two that I made was, there's no doubt that, you know, if the provider is the one to introduce telemedicine to the patient, the rate of success is a lot better. The second one is that, you know, you've actually got to do a little bit of work. And I think Steve has alluded to this. You know, they've put documentation out. And I love the fact that he's actually said, to their patients, we're happy to work in this environment, but we're not happy to work on WhatsApp. It doesn't work for us. There are certain requirements that we want as a practice, and therefore this is the platform that we choose. And as he said, once the patient understands that, it's not that difficult, ultimately.
And I mean, there's no harm, so there's no harm in using WhatsApp fundamentally to drive a diary.
Sure.
And really, that's what we do. And patients like WhatsApp because it's easy. It's simple. They understand it. So I've got a business WhatsApp on my phone right now. I'm watching. I've got 5 or 6 messages now because I have my day job and I have a hard-ass boss. So I've got to make sure that she's going to be happy tomorrow. So I've got to make sure that that diary operates well. And WhatsApp is highly effective. But I tell you what, one of the things I want to throw out there is to say, if you think about fee for service, we all understand. Fee for membership is about value. If you think about, fee for value, fee for membership, what will people pay commercially to be able to book and cancel online? So there's the thing. So now that's the kind of value that WhatsApp can provide, because it means that you can use WhatsApp to go online and cancel or change an appointment, or have access to Jenny's diary as opposed to maybe the younger therapists in our business. So there's, I think we mustn't throw the baby out with the bathwater. The social media platforms are effective, and they are, I think we can use them effectively to drive membership revenue. Another debate altogether.
On that point, though, a little bit of a loaded question: who owns WhatsApp?
Yeah, Facebook. So absolutely. So, and if anybody is not looking at Facebook Marketplace as a way in which to work within the ethical rules, but to understand how to talk to people, well, then you need to do that. I don't know what it is with clinicians. I don't know. There's got to be some secret thing that they do in final year with all of you, where they take out a piece of your brain which deals with technology and replace it with something else. I don't know, fax machine. But it seemed, it's one of those things that I think is really important not to forget, is that those platforms have value if you're able to do it in a really smart way. But there's a absolutely hard line between clinical data and clinical information and marketing and information about what you do, and that line must be absolutely drawn, and otherwise I think it gets messy quickly.
Yeah. I mean,
you were giving us some tips.
I think that's probably what that's what you guys have done so well. And I mean, that's probably my third one, is that you have to make this part of your practice. And I've seen this with providers when they're seeing somebody in their rooms, and they'll make it part of their conversation. And don't wait for the patient to bring it up. As a provider, nobody better to get information around telemedicine and what it can do than from their trusted provider. So, if you start the conversation and say to your patient, this is what we do, we're able to, and I tell you what I love seeing sometimes, and I've seen providers do this, is they actually do a demonstration in their rooms. And my own doctor, I've seen him do it. He does a demonstration with his front staff, his front desk staff. And I love that because it shows that his practice has embraced it. His staff have embraced it. And the thing with patients is that they see these pictures of doctors with television sets up on their wall and all sorts of things. And there's this perception that they might need more equipment. Have that conversation with the patient. It's so easy. You have everything, that you need, probably a smartphone or an iPad or whatever it is, and make it part of your practice. And I just think Steve has really done that so well. And I'm just so glad that he made that point. And then, of course, whatever solution provider you use, you need to be able to have, you need to be able to reach out to them. Because if your patients have questions, or if you want to have training for your staff so that they can facilitate questions, that needs to be done. And that's also part of the solution provider that you choose. So, I mean, those are just generally, I mean, I've written an article which will be on the website, which will give more detail, but I think there've been some fantastic gems out of this afternoon. I think it's been a really, really
absolutely. But Neil, don't you think sometimes either healthcare professionals or even the patients they're going to use, let's say, for example, the Medici application, but then after a month or two, they're just going to fall back to WhatsApp and back to Zoom. Is there anything that you can put in place to try and prevent that from happening?
So, I brought this up before, and you know what my theory on this is. My theory is patients prefer to use WhatsApp because they just simply don't have to pay for your expertise and your time. You know? And that's true. And somebody has said it over here. You know, I've realized that my patients are using WhatsApp and email because I'm giving away my valuable time and expertise, and there's no expectation of payment.
Not to mention,
that's odd.
It's so important to also mention that when you are giving that professional advice over whatever channel, and we know what one of our doctor colleagues did over Twitter, you are putting yourself at risk. It's professional advice you're giving in your capacity as a healthcare professional. And you may not be charging for it, but it doesn't mean the patient can't hold you accountable and ethically liable for that advice that you're giving. So please don't merge into this like informal channels of communication, thinking that you're not held professionally liable for that. So caution.
I wonder, and maybe as a non sort of genuinely clinical person, maybe to devil's advocate that just slightly, Dion, is that people will fall back to WhatsApp and email because they don't get value. So if you fundamentally don't understand the continuum of care and what that means, and you haven't explained upfront to your patient what that means, well, then you will get exactly that. So we must also not sit on our professional laurels and say, well, this is my expectation. Understand that fundamentally people expect a value. The fact that you are professionals and medical professionals doesn't change that. And if you're not providing value and you're not providing absolute clarity in terms of what that road, what that continuum looks like, well, then expect that, because that's how they perceive you. No value, well, then I don't expect to pay for it. Absolutely. So I think it's important to be careful of that as well.
Dion, a question that came up here, and I think it involves sort of Medici and EZMed, is can you bill for it? Maybe you can just give us a bit of an explanation on that.
Excellent. Again, I'll refer you to our previous webinars on that. We unpacked it in quite a lot of detail, and I even have them as hidden slides here in case we needed some fillers, but we always run out of time and have so much to say. But absolutely, you can bill for your services through telehealth. I think what is important is that you have a track record of that engagement. Trying to bill when you send an SMS here and then a WhatsApp over there, and then you wonder, now, how do you pull this all together, is very dangerous. And what we've done successfully with EZMed is not only prompt the actual engagement of Medici and a telehealth consultation through SMS calendar reminders and all of that, with a deep link to link that person automatically, the patient automatically right back to the provider that actually set up that appointment. But the other part is when it concludes, we bring in that information in to say, there was a phone call for this long. It was a voice call. It was a video call. There were text messages that went back and forwards. And here's what was said by both parties. The practitioner decided to get another colleague in to that conversation with the patient to have a three-way conversation to brainstorm this patient's a plan of treatment. They were then left out and he carried on the conversation with the patient. All of that information is brought right back into EZMed against the clinical notes so that you have that record. It is part of the patient's electronic health record. It's part of their history and engagements. And you then pull all that in again. And then from there you say, okay, I'm looking at this now. How do I bill? Here's a button, click that, and then convert that straight into a bill that goes through the normal channels that you've engaged with the patient before with your informed financial consent. But it's all succinctly brought together, because you may be held accountable for a forensic review, an HPCSA review, a Department of Health inquiry, whatever it might be. And you don't want to hold your breath when you turn to your filing cabinet, don't find anything, and start scurrying around on all kinds of channels of where on earth did I say what? This patient said so, but I don't remember this. Yeah. So it's about bringing that all together. If you're doing that successfully, responsibly, and ethically, then absolutely bill for appropriate care given through telehealth. The last thing we want is a blowout where everybody's suddenly sitting on their phones and consulting with patients they wouldn't normally have followed up with because they're running out of cash for their practice and they're locked down. So it is really important that we handle this responsibly. And there's a question too about, so what happens post-COVID or post-spike? What is the HPCSA going to do then? I don't think this is something you can easily put the genie back in the bottle, the cork back in the champagne bottle, whatever you want to say. We have hatched accessible, affordable healthcare here and shown that it can work. And I do believe that the practitioners have been very responsible about how we've done that. So
outcomes, certainly, Dion. I mean, outcomes are going to be the only thing that counts at the end of the day. So what happens post-COVID is that if all of these folk today on this call have a bunch of patient data that includes things like demographics, clinical data, activity data, and outcomes. Well, then there's an absolutely, like, what do you do with that? So if you want to walk this back and you're a funder and you're going, I'm paying too much money out of my pocket for this. But there are thousands and thousands of patient case studies where the outcomes have changed.
Yeah.
Where the quality of life, it doesn't have to necessarily be a clinical data change, but you can't tell me that a quality of life change fundamentally over a 3-month period, or a Hamilton depression scale change, or a pain catastrophizing scale, which looks at, how do you feel, is not an outcome. Of course, it's an outcome. But if you've measured it correctly, you've tracked it correctly, you've billed appropriately for it, well, then you're going to have, all of us who are on this call today are going to have thousands of case studies of patients who have got better. And isn't that...
You captured it on a digital platform. And you can actually use the data.
Absolutely. Someone can. So, Doctor, go down to Wits to Dr. Toria. She'll go and research the hell out of this. So there's a bunch of master students who are digging themselves. So get very excited right now.
Guys, I need a bell to stop you talking. Time has unfortunately run out. I mean, what a great conversation. We can definitely just carry on with this. Maybe just to quickly highlight some of the questions that did come up, and we will answer all of them in a separate document. But most of these are actually captured in some of our previous webinars. Things like relate to malpractice insurance, billing, consent forms, uploading of documents, touting or advertising. These are all questions that we have addressed in our previous webinars. So please log on to the website, go and view them, and go and read the Q&A documents as well, which we did provide for you. Just before we wrap up, I've got 2 last questions that I want to ask the attendees. Now let's see if I can just make this work again. Cancel that. I want to ask you the following question, please. It's a quick one. I'll give that 1 minute. So, gents, I'm going to go to you in a second just for some closing thoughts, but maybe while the poll is running, I've just got 2 things that I need to remind everyone of. First of all, we did speak about the webinar link that will be available on EZMed.solutions, as well as all the previous webinars and documents relating, as well as the articles that Neil is kindly writing to us. Second to that, there will be another webinar happening same time, same place next week. Please go and register. EZMed.solutions, as you can see at the bottom of your screen, go to the webinar tab. And this is going to be a bit of a different one. We're going to address ethical billing in your practice. And we're going to have Neil here, and we're also going to have a new panelist, Neil Hopkins. Now, Neil is a Cape Town-based biokinesthetist, and he's in private practice for many years. He lectures at the University of Cape Town around business management and practice ethics. He's also with BASA, the association, on a regional and a national level. And he's also involved with the HPCSA. Now, Neil's busy with his master's degree in bioethics as well as law at Wits. So between Dion and Neil, trust me, we've got this covered, and it's going to be a very interesting conversation. We would all hope to see you there. I'm going to stop. Let me quickly share the results on this one. The question was, do you use telehealth solution with your practice? And now that you all know that telehealth is more than just Medici, it's a WhatsApp, it's an SMS. I'm actually quite surprised at this. So it will be very interesting to see if we had to launch the previous poll. I don't think we can. I think the answers are going to change. But I want to share another one with you, if that's okay with you. Let me just quickly get this one sorted. And the question here is, if you answered no to the previous question, your telehealth and your practice management system is not integrated. Why? Why? Is it because it's not integrated? Is it the cost? Is it the cost of the telehealth or the practice management system? Is it both? Are you concerned about security? We would really like to hear your thoughts there, and I'll let that run for a minute or so. The last thing that I want to share with you, and this is just from us to you, both EZMed and Medici want to try and wants to try and contribute to your practices and to the patients during this COVID-19 period and hopefully beyond. And we want to offer you both of these products absolutely for free, for Mahala, you heard correct, to just try and to use until the end of July. If you need any more information, please log on to the website, EZMed.solutions. There's a contact us, there's some lead forms. get in touch with us, guys. We've got a dedicated team that can really take you through the systems. We can do a demonstration. You can view the demonstration online, and we're here to help and assist you. So that is one from us to you. And just a reminder, it is completely free with no additional commitments or disclaimers. So I'm going to end the poll. Thank you very much. Let me share the results there. So 62% of people said that my telehealth and my practice management system is not integrated. And hence, guys, go and look at this offer that we're giving you. EZMed, a practice management system, and Medici, a secure telehealth platform, is integrated from beginning to end. And you can bill either your patient or the medical scheme directly from there. So it is fantastic. I really want you to encourage you to go and look at this all. But the time has run out. Guys, I'm quickly going to look back at you. Just some closing remarks. Maybe Steve, you first.
Sure, closing remarks. I think it would be, I would be deeply saddened if we don't take this opportunity and turn it into what it should be, which is the fundamental change in the way in which healthcare is delivered. So I'm unbelievably thankful for the opportunity from Neil. Dion, thank you so much for including me and Jenny in your thoughts at the beginning. And we need to get this to where it should be. Otherwise, I think it's been an opportunity lost.
Definitely. Thank you, Steve. Maybe Neil, over to you.
I think a fantastic webinar this afternoon. I think some really great information came out. I just hope that participants enjoyed it as much as I did. So next week I'm taking a break, so I'll be a participant. So I'll be watching the other Neil and yourself. So I look forward to that. But once again, it was an absolute pleasure to be here. We'll watch the website. All the articles and the checklist is there. And yeah, I'll see you all from the other side next week.
Thank you, Neil. Dion.
Yes, I'll keep it short. Thanks. First, I want to thank Steve and Jenny. Thanks so much for your time, Steve. It's really been insightful to see the real sort of rubber on the road kind of experiences, and we appreciate you sharing your experiences. Neil, thanks so much. It's been a fascinating 4 weeks, and I'm sure we'll have you on again. We look forward to having other panelists in to sort of continue with these almost fireside conversations and have people listening in, asking questions. Those questions we couldn't get to, we will answer in the Q&A. So please come back to the website to look at those. We did try our best. But also just a shout out to the team that's made this all happen. You guys can't see them. They're all behind that black block to register for upcoming webinars. The Dux Academy of Healthcare team, Wendy, Debbie, Karen, all of you, thanks so much for making this happen and allowing us to just sit down, switch on our cameras and talk. So we appreciate that. And thanks everyone for joining us. We've had close to 500 delegates. We've peaked at times close to 1,000. Please share this, tell your colleagues, tell your associations, your members, and so on. We'd be happy to have you guys here. It'll continue to be for free. It'll continue to be ethics points or general points if we aren't able to get ethics points. So really, that's just your time. And thanks for everyone who's saying it's really been valuable spending this time with us. So we welcome you back every Thursday, 4 o'clock. Lani, I'm probably taking some of your conclusions.
There was a message from someone that said, the panelists are very eloquent and enjoyable to listen to. So guys, thank you very much for joining us. And Steve, especially for you. We really appreciate it. To all the attendees, thank you very much for joining us again. All the best for your practices, your patients, and especially your families during all these trying times. Please take care, stay safe, and good night.